Speaker, sir, reply to start question number 46A. Yes, sir. B. Sir, the total number of infrastructure works proposed is 336, covering subcenter, PHC, CHC facilities. C. Sir, there is no urban health center at Laimkra till date. However, Demsenyong UPHC covers areas under Laimkra. D. Sir, does not arise in view at C above. E. Sir, does not arise in view at C above. F. Total area covered is 18 localities. Population covered by Demsenyong Urban Health Center is 18,672. G. Sir, the essential health service provided are maternal health, family welfare, child and nutrition, respiratory tract infection / sexually transmitted infection, including HIV, AIDS, nutrition deficiency disorder, vector-borne disease, mental health, oral health, chest infection, TB/asthma, cardiovascular diseases, diabetes, cancer, trauma care, burn and injury, IEC, BCC, counseling, UHNDS, urban health nutrition days, special outreach camps.
Honorable Speaker, sir, may I request the Honorable Education Minister to explain as to why, despite the fact that there are 18,672 members of the population covered under the UPHC at Demsenyong, why has it not been upgraded to a UHC till date?
So, as of now, the UPHC at Demsenyong could cater the needs of the people in that area.
So this is a very, very important question for the people of Laimkra in general. If you look at reply to 46G, a long list of health services are indicated as being provided to the people of this entire huge locality. And it is unfortunate that this UPHC has not been upgraded to a UHC yet. May I know in the program, in the UPHC, how many patients are covered under DOTS?
I don't have the reply on the dots, but the UPHC has catered average about 1,000 patients every month.
Sir, is the Department of Health aware that this facility that is catering to the largest extent of health services to the urban poor population in entire Laimkra is functioning from a rented house?
Yes, sir, the UPHC at Demsenyong is functioning in a rented house.
Honorable Speaker, sir, may I inquire from the Health Department whether there is any proposal to include the UPHC at Demsenyong under the various infrastructure works being proposed at 336 numbers in the near future?
There is a proposal, but for this 336, this is for infrastructure and other facilities. So, the identification of land for setting up of UHC at Laimkra is on the process, and once the land is identified and if there is any unhanded over the department, so we will include in this also 336.
Sir, may I know how many pregnant women are also included in services under the UPHC at Lajumkra.
As I have replied earlier, sir, the specific thing I didn't have the record with me. But as I said, that about 1,000 patients is being covered by this UPSC every month, sir.
So the very,
Last
the
question.
very purpose of me bringing this question was because I am aware of the population that regularly visits the UPHC at Demsinyong. And it is also a fact that the government has several lands already in that same area. And in 2018, there was an effort to put in to ensure that this UPHC gets upgradation. May I have an assurance from the Honorable Education Minister that this UHC upgradation and UPHC will get a fair chance with government intervention in the immediate future?
As I have replied earlier, sir, that once the land is identified to set up these facilities, it will be taken up under the scheme of the government.
Yes, Melbourne.
Honorable Speaker, sir, in the reply A and B, we have seen the positive response from the department to increase the health infrastructure in the state. And we have seen around 336 proposed infrastructure covering sub-center, PHC, CHC facilities has been highlighted in the reply. So it is a positive move. I would like to know from the Honorable Minister whether this 336 infrastructure work to be proposed, it is through the state scheme or NHM or any other source which will cater for the needs of the people of the state.
Sir, to meet this proposal or this intervention of the government, the Meghalaya Health System Strengthening Project, which is an external aided project by World Bank, 2, the National Health Mission, 3, the Prime Minister Ayushman Bharat Health Infrastructure Mission, 4, the 15th Finance Commission, and 5, the state resources. This will meet the purpose of the upgrading this infrastructure of these 336 PHC's health facilities.
So with regard to one of the premier health facility that has to be created within the state, trauma center in Nongpo, which has been not being operationalized till now. We would like to know the mind of the department, Honorable Minister, how the government, the department is preparing to move on. What is the timeline that this trauma center, a much awaited center, especially it is located in the National Highway 40. There are very much accident cases very now and then. So we would like to know the mind of the department this, to increase the health infrastructure, the status of the trauma center in Nongpo.
As we know that the trauma center in Nongpo have already been established, so the process to activate, to make it operational will be taken up soon, sir.
Yeah, last.
With regard to MCH hospital in Ribhoi, which is there in Umsning, this is also a much awaited health infrastructure which will help the pregnant mother, so that we'll have a facility for the whole of Ribhoi. So we would like to know when this MCH hospital in Umsning will be operationalized, so that it will be a benefit for the people of the district as well.
Sir, the process is on, and the government will take every step so that it will be activated soon.
May we know the timeline, sir?
Sir, as of now, the MCH hospital is also used as the COVID center, sir. So we will see as soon as this phase is over, so the department will take necessary step to operationalize this MCH, sir.
Thank you, sir. So at the very outset, I would like to thank the government, particularly in the Minister in charge health, who have been very kind to consider in yesterday's question which I saw relating to setting up of an infrastructure in South Sampair where a PHC is being considered to be constructed. And also, sir, I must thank the government for the Lauba PHC, which has already been completed, but I would request the Minister to kindly inform the House as and when this PHC in Lauba will be made functional, sir.
Sir, the department has already taken steps to meet the need of the people. So that's why Lauba has already been taken up, and the process to operationalize it is on. And as we know, sir, as of now, there are the MPSC also are recruiting the teacher, doctors. So as soon as the manpower is there, then we'll be able to do the needful, sir.
Well, sir, I think the manpower is already in place. All the doctors, nurses, the lab technicians, everybody is already in place. The only thing required is for the hospital to start functioning. And may I inform the Honorable Minister that through the Forest Department, under the SPV, they have sanctioned more than 1 crore for purchase of the equipments for this hospital. So I just wanted only that kind of an assurance as to when this hospital will be made operationalized.
So as of now, the OPD service is going on, sir. So with that information of the honorable member, the department will take note, and necessary step will be done to meet the need of the people of that area. Thank you, sir.
Charles Bongro.
Sir, just one last one, sir, if you don't mind. Sir.
Please.
Yes, sir. Thank you, sir. Sir, I'm again coming back to infrastructure, sir. Sir, along the border, international border, there are more than 40 villages, sir. Now, in these villages, we have only one hospital, PHC in Dangar. Now, I would like to request the government to consider upgradation of this PHC in Dangar to a CHC, wherein it will benefit the people of that area if we have more doctors and more manpower, so that the people of the border need not come all the way to Shillong for any kind of treatment. So may I have kind of an assurance from the government that they will examine the upgradation of this Dangar PHC to a CHC, sir?
So, sir, the request of the honorable member is taken note by the department.
Sir, may I know from the Honorable Minister whether the UPHC at Nongthumai, which is now under, the accommodation is rented, whether any proposal has been given by the government to acquire their own land so they can have a separate facility for this?
I have no information with me regarding Nongthumai, sir. I require notice.
No, I just want to know if the government, the department will take into consideration the acquisition of land for setting up its own facility rather than operate from a rented facility, sir.
As I said before, sir, it is the government always want to have the facilities, it's its own accommodation. But having said that, so the government is looking and will consider as and when the land is available, sir.
Sir, there's one more question here. During the last pandemic, this facility had to really cater to a large section of the population, which also was spread out over a larger area. And one of the demands, not the demands, the request was if a vehicle could be provided to this PHC with the drivers so that, the movement of the ASHAs and the other health workers could be, the deliverance of their work could be done in a proper manner. So if you can place a vehicle there, it will be a great help to the UPHC there. So will this department consider this request?
So as I said that since the information regarding the facilities in Nong Thamai is not available with me, I require notice.